Friday night it is. Let me welcome onto the Power Seat this Friday Michael Gullan. He is the founder and CEO of G&G Advocacy. Michael provides strategic consulting to G&G advocacy clients at a very senior level. Michael is passionate about the science of adult learning in the corporate workplace and has made it his mission to provide innovative and effective e-learning solutions to nurture an educated, high-performance workforce in South Africa so that he can build a stronger, more sustainable economy that creates more jobs and opportunities across all levels of our society. Michael is deeply committed to uplifting South Africa through education and the creation of a knowledge-empowered workforce. Good evening, Michael. How are you doing? Welcome to the show.
Good evening. Thank you so much for having me tonight.
Thank you. Michael, you are working a lot with pharmacies, and pharmacies really are the first point of medical response. Why do you think pharmacies are the place and the quick and out choice for most South Africans today?
Well, we view our pharmacy as that place to collect medication or buy a product or get a prescription filled. But I think what we often forget is that it's a source, also a valuable source of professional healthcare advice.
Yeah. And is it better for people to first go to a pharmacy before they can see a doctor? Does that make sense?
I think so, absolutely. If we think about it, pharmacists are well positioned to provide intermediate guidance and treatment recommendations for common ailments, and they really are highly accessible healthcare professionals who can assess our symptoms and provide us with that evidence-based advice and then make the recommendations that we need and provide us with treatment options, and then where necessary, refer us to a doctor or specialist.
Yeah, okay. In a healthcare system under pressure like in South Africa, what role should pharmacists play as the first point of care for common ailments?
Yeah, I think that when we give thought to that question, they're able to give patients access very, very quickly to advice and to treatment, and in doing so, they reduce unnecessary pressure on clinics and doctors and emergency departments. By acting as the front line or primary healthcare, pharmacists help ensure that patients receive the right care at the right time from the right healthcare professionals. And in doing so, they're actually improving healthcare access and patient outcomes and the overall efficacy or efficiency of our healthcare system.
So the healthcare system really should look at pharmacists as the first point of medical response?
Absolutely. I think so. And we see it, don't we? Play it out in thousands of pharmacies around the country on a daily basis,
Yeah.
particularly in rural areas.
Yeah, I like that. Yeah, that's quite important. But do we have as many pharmacies in rural areas as we should?
Absolutely not. And I think that's probably one of the biggest challenges that we face. And I think, from what we understand, that's becoming ever more a priority is the rolling out of more pharmacies in those rural areas to ensure that those communities have access to the right healthcare.
You say deep clinical education shapes recommendation behavior. Can you explain how that translates into safer treatment choices for patients?
Absolutely. I think when we say that, what we're really talking about is the quality of a pharmacist's recommendation and how that is directly influenced by the depth of their knowledge and their confidence. A pharmacy professional who understands a condition or ailment and the symptoms and treatment options and the contraindications and that sort of thing is very likely to ask the right questions and identify potential risks, and then most importantly, recommend the most appropriate solution for a patient, which leads to safer treatment choices for our patients.
Pharmacists are trained to ask about symptoms, other medicines, and health history. How does that make the advice different from generic self-recommendation? Or some people just go onto the internet and, they type out an ailment and there's a response. What's the difference?
Yeah, I mean, Dr. Google's great, isn't it? I mean, we all have an honors degree in medicine thanks
Yeah,
to
yeah.
Google. But really the difference is personalization. A pharmacist doesn't simply recommend a product based on what's on the shelf. They train to assess our symptoms and they ask us the right questions. They ask us about our medical history, the kind of they check into what products we or medication we're taking, our age, pregnancy, allergies, and other sort of things. And that really helps them determine not only which product will work best for us,
Yeah.
but whether it's safe and appropriate. Whereas a generic shelf recommendation is simply based on a product versus
Okay.
that recommendation from a pharmacist that's based on a patient need.
Okay. So with medicines and guidelines constantly evolving, how does Pharmacy Institute keep pharmacists' knowledge current and practical in these day-to-day changes that occur within medicine?
Yeah, I have enormous respect for our healthcare professionals in the country because that's a primary need of theirs. They spend so much time looking after us, and at the same time, they need to ensure that they're up to date. And we
Yeah.
support them in doing that through the provision of continuous evidence-based learning that's designed specifically for the realities of their
Mm,
pharmacy environment.
mm.
And we do that with a micro-learning approach. So what we look to do is support them with focused, clinically relevant, ailment-specific content that they literally can access and complete bits of it quickly and efficiently to make it easier for them to stay current without disrupting their workday.
Okay. You focus on adult learning for the corporate workplace. What makes e-learning effective for busy pharmacy professionals who need to apply the knowledge immediately? Do they like go into a system and you give them the right kind of response information?
I mean, that's it. You've got it spot on. It's
Mm-hmm.
more than delivering the information. It's exactly what you said now. It's
Mm-hmm.
about delivering the right information at the right time in a way that they can apply it, so they have access to that information in that moment of need.
Okay. For your work with G&G Advocacy, what's the biggest misconception South Africa have about pharmacists?
Yeah, it's such a shame because too many South Africans still think about pharmacists as simply dispensing medicine prescribed by doctors.
Mm.
But the
Yeah.
reality is they're highly trained healthcare professionals who very often, as we were talking about just now, the first point of care, and they have the knowledge to assess our symptoms and recommend appropriate treatments and provide screenings, vaccinations again, particularly in rural areas. They support chronic disease management, they refer patients
Yeah.
when further medical attention is needed.
Yeah. When, uh, Michael, when do pharmacists know that the job is done and it's time for the patient to see a doctor?
Well, that's a great question, and it's quite simply about asking questions, the right questions, and understanding the ailment that the patient suffers or is suffering from, and their prior medical history, and whether there are any red flags present. And then, based on that information, they have the appropriate training to identify the risk or the correct course of action and recommend a referral to a doctor or specialist where necessary.
Okay. Pharmacy Institute helps brands move from awareness to advocacy. What does advocacy look like for a pharmacist on the floor?
Well, I think the misconception is that it's really about promoting a product or a brand, but it's not. It's about confidently recommending the most appropriate solution for a patient's needs. So, on the shop floor, advocacy occurs when a pharmacist has sufficient knowledge, confidence, and clinical understanding of a product to consistently consider it as a treatment option during patient consultations. It's at that point that the brand moves beyond simple awareness and becomes part of a pharmacist's trusted recommendation set. And that is when it becomes what advocacy looks like on a shop floor.
With Dr. Gogo, we mentioned this earlier on. Self medication is common in South Africa. How can trusted pharmacists advise reduce risk from misuse of OTC medicines and supplements?
Yeah, big risk, isn't it?
Yeah.
And I think the role of a pharmacist is they help ensure that patients choose the most appropriate product for their symptoms. And they use it at the correct dose. They understand how to take it safely. And they also identify potential interactions with other medicines or existing health conditions that may not be obvious to the patient. So they're
Hmm.
able to do that analysis and provide trusted evidence-based guidance at the point of purchase, versus, as we said, just self-diagnosis and misuse of OTC medication.
For someone who can't see a doctor right away, what makes a pharmacist the best alternative?
Well, when a doctor isn't immediately available, a pharmacist is very often the safest first point of contact because they're highly trained healthcare professionals. They have extensive knowledge of medicines and common health conditions. So they're able to do those quick assessments, provide the right advice, and and in so doing, they provide many South Africans with that first point of access to medical treatment where they can't necessarily get it.
All right, so what would better use of primary healthcare look like in South Africa if more people started very early, to go and see and talk to a pharmacist about their problems before things get out of hand?
Yeah. Yeah, it's such an important consideration because if more South Africans did that, essentially, primary healthcare in South Africa could become more accessible, efficient, and cost effective. Because when we're going to a pharmacist, for the advice and treatment recommendations we've been talking about here, what it does is helps reduce unnecessary visits to doctors. It
Mm-hmm.
eases pressure on clinics and emergency departments, and in so doing, ensures that those healthcare resources are focused on the patients who need them most, and the patients then who would benefit from faster access to professional healthcare advice and earlier intervention to sort of for minor ailments and that sort of thing, get that guidance quickly from a pharmacist.
Michael, do we have enough pharmacies around South Africa to service the population?
Look, in my opinion, and based on the pharmacies we interact with and some of the governing bodies, I don't believe so. But I also believe that it's a need that's very well understood and is something that I think is being addressed with the best will in the world.
Yeah, okay. What is one practical message you'd like every South African to remember the next time they walk into a pharmacist?
Yeah, it's a thing we were talking about just now. That would simply be this. Before you Google it, ask your pharmacist.
Before you Google it, go and see your pharmacist first. All right. Michael, thank you so much for having joined us tonight. It's really important information you had to share with the rest of the nation because health is everybody's concern. Thank you.
Thank you very much. Have a good evening.
It's now 25 minutes to 11 on Channel Africa.